What's this hump on my back? Hey, this is Dr. Jeff Williams with Creekstone Integrated Care right here in Amarillo, Texas, and I'm coming to you again this week with a brand new video. We're talking about humps on people's backs, if you haven't already guessed. From the top, let me say this. If you like this information in this video, do me a favor and share it with your friends and family so that we can help more and more people with some very solid, research-backed, and evidence-based advice. Now, it is very common for us to have new patients come in for neck pain or low back pain. We always start by taking a good history and performing a very thorough orthopedic and neurologic exam. And it's typically after I've completed everything, explained everything to the patient, and I'm about to start working on them when they kind of stop me for one last question. And that one last question is commonly, can you tell me what this hump on my back is? Now, that's about the time they start running their hands and their fingers over the area where your neck turns into your upper back. The usual answer when I ask if it hurts is no, but I see it in the mirror and I'm afraid I'm going to end up looking like my grandma someday. Now, what they're referring to is technically termed kyphosis, or sometimes it's termed hyperkyphosis. Mild kyphosis may be something that is less than desirable cosmetically, what you see in the mirror, but causes no real issues or really should be any source of any real concern. More serious kyphosis, according to the Mayo Clinic, can be caused by the following: fractures, broken or crushed vertebrae, like compression fractures. Those can result in curvature of the spine. Mild compression fractures often don't produce noticeable signs or symptoms, though. Osteoporosis can be a cause, and this bone thinning disorder can cause spinal curvature, especially if weakened vertebrae result in compression fractures. Osteoporosis is a cuss word in a chiropractor's office, and it's most common in older women and people who have taken corticosteroids for extended periods of time. Another cause of this hyperkyphosis or hump is disc degeneration. Soft circular discs act as cushions between the spinal vertebrae, and with age, these discs can dry out and shrink, which often worsens the kyphosis, but not to an extreme amount typically. Another cause is called Scheuermann's disease, and also called Scheuermann's kyphosis. So this typically begins during the growth spurt that occurs after puberty. Boys are affected more often than girls. Another cause of the kyphosis could be birth defects. Spinal bones that don't develop properly before birth can cause kyphosis. Now, kyphosis in children can also be associated with certain syndromes, such as Ehlers-Danlos syndrome, which I've done a video on. Just go back and check our YouTube channel. Marfan syndrome is another one. Another cause could be cancer in cancer treatments. Cancer in the spine can weaken vertebrae and make them more prone to compression fractures, as can chemotherapy and radiation cancer treatments. Obviously, none of that's any fun. Now, these more sinister causes, they're more dangerous, definitely less desirable, but they are very, very much rarer, more rare, much less common, if you will. Most small little humps at the neck and body junction, they're actually anatomically very normal, and literally everyone has one. They're so common that this area and that little hump has an anatomical name. It's called the vertebral prominence. Prominence is a fancy way of saying prominent or obvious, right? It sticks out more, it's prominent. Your seventh cervical vertebra at the base of your neck is typically the vertebral prominence, but it can be the T1, which is your very first upper back vertebra in your spine. Again, as the name suggests, it just sticks out a little bit further as your neck curves into your upper back. At the end of the day, whether it is your seventh cervical or your first thoracic, it varies from person to person, and it doesn't really matter at the end of the day. The point is that little hump is normal. However, there are some things that we can do that can cause our vertebral prominence to become more and more prominent. The most notable of those is being consistently in a poor posture position, and that's it turns into a situation called upper cross syndrome. Just Google it, upper cross syndrome. And let me be clear, there really is no bad posture per se. As long as a person switches postures consistently and regularly, there is no posture that is really going to get anyone into any big trouble. And that's according to more recent research. Truly bad posture is any posture that is held consistently for extended periods of time. For example, if a person is accustomed to sitting most of the day, every day, in one position, well, that's bad posture. If a person has a habit of sitting kind of slumped forward with their head stuck out kind of like a chicken, and that goes on consistently for some time, daily, that would be absolutely considered bad posture. The most concerning thing we see as chiropractors right now would be teenagers and young adults looking down at their electronics all day long. A person simply cannot adopt that type of posture with any regularity and not suffer the eventual consequences. It's a slow burn, but trust me, it's gonna catch up. If a person is switching positions all day long, every 5 to 10 minutes, sitting like this and then looking at a computer like this, and then you change positions and you go, and you're moving around every 5 to 10 minutes, well, that's not necessarily considered bad posture. Although no healthcare professional I'm aware of is a proponent or is in support of sitting all day, every day, regardless of the changes in position. No healthcare provider is going to tell you it's okay to sit all day long. So keep that in mind as well. When patients spend a considerable amount of time sitting, slumped over with their head jutted forward, looking into a computer screen or driving all day, every day, this develops into what is commonly called, as I mentioned, upper cross syndrome. According to healthline.com, quote, upper cross syndrome occurs when the muscles in the neck, the shoulders, and chest become deformed, usually as a result of poor posture. The muscles that are typically the most affected are the upper trapezius and the levator scapula, which are the back muscles of the shoulders and neck. First, they become extremely strained and overactive. Then, the muscles in front of the chest, called the major and minor pectoralis, become tight and shortened, right? Patients most at risk of developing UCS or upper cross syndrome are those that read a lot, watch TV, biking, driving, or using electronics often. Some of the more common symptoms of upper cross syndrome are neck pain, headache, weakness in the front of the neck, strain in the back of the neck, pain in the upper back and shoulders, tightness and pain in the chest, jaw pain even, fatigue, lower back pain, trouble with sitting to read or watch TV, trouble driving for long periods, restricted movement in the neck and shoulders, pain and reduced movement in the ribs, pain, numbness, and tingling in the upper arms. Now, how many people does all of that describe, right? As you may have guessed by now, upper cross syndrome can accentuate the vertebral prominence, like I mentioned, and most definitely make it more noticeable. As I said, there is no truly bad posture. It's more about the consistent and long-lasting postures that get patients into real trouble. Once these muscles and connective tissues are put through the same stresses long enough, consistently enough over a long enough period of time, well, they start to remodel. And when they remodel and change themselves to accept their new normal, you can't reverse it. So now is the time to correct it. So for all of these reasons, patients need to be certain that they're changing positions regularly and consistently to the greatest extent possible. Stretching, working on ranges of motion, and getting up and walking around regularly. It's also helpful to keep in mind the perfect ergonomic positioning when sitting is having the ear hole above the tips of the shoulders. and the shoulders directly above the hips and the feet separated flat on the floor. Sliding or gliding your head directly backwards when stretching and sitting for long periods of time is always a great idea and helpful. Some of the causes of hyperkyphosis, they can't be controlled, and everyone on the planet is born with a vertebral prominence, okay? But those are rare instances when you have a kyphosis that really cannot be controlled. More times than not, any little hump is only a cosmetic concern. If for some reason the hump is a little more than you like or want, start with more frequent changes in your normal posture. Further down the road, you can engage in some upper cross syndrome exercises that you can easily find anywhere on the internet. And beyond that, there are very rare instances where one may have a benign, harmless, fatty tumor called a lipoma. In that case, a dermatologist can typically easily remove a lipoma if that's the case. Now, if you are from the Amarillo, Texas area and you're going to be traveling through and you need to be evaluated or examined, just give us a call here at Creekstone Integrated Care, Amarillo, Texas, 806-355-3000. Set up an appointment for us to take a look. If you're watching us on YouTube, hit subscribe so that you don't miss any more videos. If you're watching on Facebook, if you can share this video, we can help more and more people. And at the end of the day, that's the big goal. Again, this is Dr. Jeff Williams with Creekstone Integrated Care. Stay healthy. We'll see you next week.